delivered by none other than Justin Malachnik, who is the Director of Safety and HR at JTM Construction. And Justin was recommended to me by one of my colleagues at Region 10, University of Washington, Nancy. And Nancy said, Rhett, you should reach out to Justin. This has been a great program and will be fantastic for the summit. So we are thankful for Nancy's recommendation for this, and certainly thankful to have Justin and his expertise on this topic. Justin, welcome today. We appreciate you coming in and taking time out of your day to deliver to our group, and we look forward to hearing what you have to say.
Absolutely, Rhett. Thank you. I'm going to go ahead and share my screen here and make sure I've got it on the right one. Is everyone seeing my presentation mode, or are you seeing my...
Yes, it's there.
Okay, fantastic. All right. Before I get into this, I want to go back to the L&I update, and I think sometimes we get that humbling reminder of why we're involved in occupational health and safety. We can get wrapped up in a lot of different programs and just different things within our practice in occupational health and safety. But ultimately, what we're trying to do is prevent death and illness. The ultimate. And that just made me reflect for a moment of the fact that we've had a couple of really tragic events in our state over the last several weeks. It also makes me reflect, too, on the fact that the ripple effect of that fatality within that family is going to be felt deep, not just with the family members that were witness to the event, but just the ripple effect throughout the family. And I'm certainly going to be thinking about them and thinking about how maybe I can do things just a little bit better within my organization with the people I impact to try and prevent those types of things. It's really, really hard to hear. Sad news. So let's transition a little bit here. I'm happy that Rhett had kind of talked about Nancy Simcox at UW, referring me over to this. I've actually been working with the Oregon Occupational Health and Sciences and Healthy Workforce and SAFE down in Oregon, and have done a couple of presentations around total worker health. And my involvement in total worker health has come from my personal interest and background in psychology. That's what my educational background is in. And probably about 10, 15 years ago, as I was working as an occupational health and safety on-site professional, I was doing a lot of accident investigations. And as we were, figuring out causal factors and drilling down to a root cause of what we thought, I kept noticing that there was a piece that we weren't really digging into. We would talk about it. We were really trying to, at the time, we were trying to get away from the shame and blame of an individual. And in doing that, we were kind of discounting that individual in an event and not thinking about how that individual and their health, their wellness, how much rest did they get the night before? What are they dealing with outside of the workplace? How those types of things potentially impacted that incident, and how could we potentially intervene on those things to help prevent injuries, illnesses within our project. So as those crossroads came, and as I kind of started to recognize that there was a relationship there that I wanted to dig into a little bit more, that's when I got into occupational health psychology, and ultimately how I got associated with total worker health. So this training today, this is just going to be a very, very high level awareness training. I am not a PhD. Usually the individuals that do this presentation, like Katia Costa Black, Dr. Black, is the one I usually do this presentation with. She's got a long list of research that she's completed and is really, really knowledgeable about how these programs work on the academic side. What I love about being involved in this is that I can kind of speak to it and present it in a way on the application side. I think that we do a lot of great research around occupational safety and health and wellness, but sometimes we miss that bridge where we say, okay, well, how does that work in the workplace? How does that work day to day? That's great that we've got some numbers we can plug in, and we've done some research, but how can I apply that? So hopefully today we talk about what total worker health is. You take a little something away as far as your understanding of what it is, and maybe there's some real life application that you can put into place. But I do want to preface that this is abstract. It's not an off the shelf like, okay, we do total worker health and this is what it is. It's a collaboration between a lot of different stakeholders within organizations. And it's everyone working together. And we'll get into the 5 pillars of total worker health and how it all kind of clicks together. But the other thing I like to talk about when I introduce total worker health is that a lot of us on this call are already doing stuff that we would kind of qualify under the umbrella of total worker health. So it's not necessarily a breakdown of your whole entire safety program and culture, and you have to start from zero. And oh, nothing we've been doing before is total worker health related. We have to start all over again. No, absolutely, there are things that your organizations are doing that fall underneath this umbrella within this kind of organization of things. Hopefully today we can kind of give you some insight as far as how things are all connected. So let me move on to the next slide here. So as I alluded to, we're going to talk about total worker health. We're going to identify the 5 defining elements of total worker health. And then if we have time, I've got a couple of examples, certainly interesting ones, where total worker health approach was applied. As I said, this is really not a simple complex. I really don't want you to get discouraged. I know when I was first introduced to some of these topics and things, I was thinking, well, gosh, like I really need to just start from zero. But it's not that complicated. There are things that we're doing, and it's multifaceted. We're doing a lot of the things like when we talk about wellness programs, a lot of times I think there's a little bit of confusion between, well, is wellness total worker health? It's part of it. It certainly is a contributing element to a total worker health approach, but that's not all of total worker health. And I talked about the stakeholders that are involved in a program like this, thinking about risk within your organization, diversity, human resources. Obviously, occupational health and safety is involved, and leadership. All those pieces within an organization are kind of working together to put together a program and manage what total worker health is within an organization. This is a great illustration of how the cogs in the wheel all kind of work together. Total worker health is a framework. It was developed by NIOSH to advance worker safety, health and well-being by improving the design of work, management practices, and the physical and psychosocial work environment. So all those pieces kind of work together, and it all kind of fits and works within the process of keeping workers healthy and have a good well-being. The framework was, again, developed by NIOSH. I do have to refer back to that a couple times because it's actually a trademarked program, and NIOSH did this for very specific reasons because they didn't want there to be confusion on, is total worker health a wellness program? Is total worker health safety culture? What is it? They actually trademarked the term total worker health in the program. So here's the definition. This is how NIOSH defines total worker health: the policies, programs, and practices that integrate protection from work-related safety and health hazards with promotion of injury and illness prevention, efforts to advance worker well-being. All those things and elements work together. The main proposition of total worker health is the idea of how you're bringing all these pieces together. How do psychosocial stressors and hazards in the workplace impact the health of your workers? So it's traditionally we're looking at the environment, we're looking at exposures, say in construction on the job site, of an interaction between equipment, an interaction between a fall hazard or something like that. This total worker health, the idea is that we're bringing several more elements into the understanding of what the worker is exposed to on the job site. As I talked a little bit before about the trademark thing, they did that because they don't want it to be misused or mistaken with other things that may not be fully protective of worker safety and health. It's really a comprehensive approach that they wanted to keep everything in mind. And I'll tell you, I've actually had my hand slapped before from the department by using the total worker health without the trademark. So they're very, very particular about that, and we need to remember that. And certainly when you see this definition and you think about it, we have to take a step back and recognize that, yeah, work affects our general well-being. How you're treated at work affects your entire attitude about work. And so it goes, much beyond what traditionally sometimes we get very, very focused on. There are a lot more things that we need to be considering and thinking about. So what are the main premises of total worker health approach? Certainly, we're recognizing the whole worker and what their needs are and what their overall well-being is. We're prioritizing, the entire person. So again, a lot of times we take a slice when we're doing occupational health and safety, and we're focused on very particular things, a task. And we have an opportunity to take a step back and look at things as a kind of a human-centered culture overall, very, very inclusive, a holistic approach, if you will. And total worker health also really gets into systems thinking, really talking about evidence-based, evidence-informed interventions and data-driven stuff. So when it comes to total worker health, there is an element of, do I understand my workforce? How are they feeling? What are their pain points outside of the job site? And one of the examples I like to give, and I might have it later in the presentation, is the daily commute and how that impacts a lot of different things within an individual. And I've got a great example right now. We've got a project down in Tacoma, and we have a lot of our workers and staff that actually live, down south, and the accessibility to the job site has turned their normal commute from an hour and a half to 10, 15 minutes. I have not seen a high level of morale that I haven't seen that in a while as I see on that project. It's actually really, really amazing what that kind of impact has. And I know a lot of times you might hear something like that and you say, well, I can't do anything about people's commute. Well, I mean, I think there are flexibilities there, and we can think about schedule flexibility. We can think about location of work. And sometimes it's a little bit harder to break those things down, but if you're doing an evaluation and you see you've got 17 different work sites that people can work at, and 5 of them are within 15 minutes of the worker's home, that might be of benefit to allow them to work within the closer location. The impacts, again, I said before, like a ripple effect of a short commute can be, less issues with fatigue. It gives a work-life balance for the individual. It kind of has a number of potential impacts there. So it's really, really important. We're always trying to zero it down to, zero harm, free of harm on our projects within our workplaces. That's the utopian safe environment. That's the goal. But unfortunately, that's very difficult to do, if not impossible to do, to completely eliminate harm. So this is I'm sorry, harmful situations. This is an opportunity for us to think about this in a different way. Move on to the next slide here. And I will say, let me just plug in real quick. Please be patient with me. I actually woke up not feeling 100% today. So if I've got to take a little bit of a break, just give me a second on doing that. So let's talk about proactively addressing work conditions. I alluded to psychosocial conditions. I'm going to make the assumption that, many of us have had interactions with those before. Those would be like stressors in the workplace. Those would be like negative interactions, toxic relationships with leadership, stressors with and conflict with other workers. I come from the construction industry, and I think about how the interpersonal relationships develop between crews and then the different crews on a job site, and how those can have impacts to an individual's experience, their mental health and mental well-being as well. Organizational conditions as well. Those are things that, how we structure our organizations and how that impacts the individual. And then the one that I think that a lot of us are very familiar with, which is the physical environmental conditions. If you're familiar with the ISO standards, they definitely have a systematic approach that could be very relevant to total worker health. And I think there's a lot of parallels that come between those. So if you have a chance digging into the ISO codes on mental health and occupational well-being and occupational safety would be a good spot. And I think a lot of us really try and drive beyond the legal and regulatory compliance thing. I've always described it to people that have worked with me before is that, the regulation is put into place because we've had situations, bad things happen, recognition that there are unsafe conditions out there. So the regulation is put in place. But how can we ensure we're meeting that to meet the regulation, but do better? What's the best practice? And I think a lot of times above and beyond regulation is what we need to be looking at. And then finally, proactively addressing, work conditions. Really, the most impactful thing happens when it's upstream, managing changes early on within an organization. And we'll get into what leadership's involvement is in that when we're thinking about making some changes. So the question, I'm not going to ask for responses here, but think about this. This is a little interpersonal reflection. How does work influence health and well-being? Um, I would certainly say it does. I think a lot of times we focus on the negative, but there are definitely positives that our work does and influences how our lives are. We spend a third of our life at work, so you better believe it's going to have an impact on your well-being. And when, oftentimes, and it's kind of, I would say it's kind of pop psychology right now. We're talking a lot about the stress, the burnout, depression that comes along with a negative influence of work. But we also have to reflect on the positive influence of work. There's a social connection that comes with having a job, a purpose that comes with it. I think that, when you start looking at the statistics of like injured workers and the longer amount of time that they stay outside of the job, you see a decline when it comes to well-being, and I think that speaks to that having that purpose. Certainly, when you have a job, it gives you financial security and benefits. And did you ever think about this? Most of our interactions with healthcare is related to our work. A lot of us have healthcare plans that come from our workplace, and so there's this relationship between work and how we seek healthcare and well-being. So something to think about. Uh, we have to think about that work conditions determine the risk for injury, illness, and disability, especially in like the construction industry and a lot of other high-risk injuries. That increases a number of different things. If you have higher risk, you're probably going to have higher stressful situations. And so all these things are interrelated. Important aspects of our work, such as wage, location, influences our health and the communities in which, and certainly in which we live. So there's an impact back to the communities afterwards, as we talked about and heard about the tragic incident that just recently happened. How is that fatality not only impacting that family, but the community that family is involved in, and the well-being of those folks? So you can kind of see that total worker health is you're kind of adding an element of public health to occupational health and safety. All right. So, I talked about the statistics and the data-driven um, approach to this. That we're not just making stuff up and like throwing it against the wall and see what sticks. There is definitely research that speaks to the strong connections between work, overall health, and well-being. When I think about our industry, my industry being construction, and I think about chronic pain and opioid use, we've definitely have been talking a lot about opioid use, not only within our workplaces, but within the community where we see abuse and addiction that comes with that. But thinking about the point where some of us work in industries where chronic pain is a reality, and if we don't have interventions to help with chronic pain or injuries, those are going to happen, and then we have a pain management regimen that we need to think about, and that's when opioids might be introduced to help an individual. It's a tool. It's to help them deal with pain. So there's a relationship with that, and that's where opioids get introduced. There's a relationship between mental health conditions and musculoskeletal disease, and disabilities that come along with that. So the psychosocial stressors that we are exposed to at our jobs can have an impact on our overall well-being. Mental health conditions and cardiovascular disease. I think that many of us are attached to organizations like Hard Hats for Hearts, specifically to construction. Um, and there is definitely a relationship between the stress of the job, the physical aspects of a job, the overall well-being, what diet that people are eating, and cardiovascular disease. And related back to the job site, this is another example I like to give. And this is, again, specific to construction, but think about food choices that we give some of our workers. If you're working a schedule where you start at 6 o'clock in the morning and you may not get done until 7 o'clock at night, and the expectation is that you're supposed to find a way to get to the grocery store and put together a healthy meal and pack it up and be ready for the next day. That's not setting up for success. That puts a lot of stress and strain, not only on an individual, but trying to manage and balance that within a home, maybe where there's a couple kids and there's daycare and there's other things to think about. So what are the food choices? Usually maybe there's a food truck that pulls up. Maybe it's a rock star to get going in the morning, and something else that may not be the healthiest thing that's going to kind of feed into that development of an unhealthy diet. And the other misconception that I've really noticed is that with physical labor jobs, I think a lot of individuals think that if I work in a physically challenging job that I have good cardiovascular health. That's not always the case. Diet has a lot to do with that relationship. And so educating workers is another huge piece. When we think about total worker health, is just making sure people are informed and understand what's going on in their relationship between their work life, their balance of diet and well-being. Relationship between musculoskeletal and obesity is another one that we need to think about. Very, very strong connections. Burnout and obesity, those are very heavily related. And stress and musculoskeletal. All these things are they're related, and we can certainly start to come up with interventions, and then thinking about things like, okay, how within my organization are we talking about diet and wellness? Are we talking about burnout? Are we talking about stress, and how to manage stress? I think we're starting to dig into some of those things, but I think we need to remain focused on that. Moving on to the mental health effects of physical health, and vice versa, specific to the construction industry. We, over the past several years, have had to deal, maybe deal is not the right way to phrase that, but thinking about the unfortunate events that happen with suicide in the workplace. And when you saw the relationship specific to construction, construction industry loses more workers to suicide than workplace accidents. And a lot of that stuff doesn't necessarily get tracked. We're just starting to get a little more educated on those relationships, but they're there. Construction industry definitely has one of the highest rates of suicide among all industries. And I think that there's a lot to unpack there. We don't just say, okay, suicide and mental health, okay, solved. Like we just need to attack mental health. There are a lot of different factors and things that we have to think about. But one of the pieces that's very, very important is, again, considering the whole worker, and that mental health is a growing concern in the construction industry and all industries. And there's a relationship there. And it ties back, like I said, unpack a lot of different elements there. Depression is one of them. When you think about certain industries, there's a relationship between heavy alcohol consumption, chronic pain. I alluded to that a little bit earlier. Chronic pain and opioid addiction are certainly prevalent in the construction industry and other industries as well. But we need to make sure that we're considering these types of things and that they are interconnected. Mental health, physical health. The last slide with just how all those things are attached. We have to be aware of those things, and when we are aware of them, then we can start to say, okay, well, how can we make an intervention between these things? I'm going to skip this slide because this one is specific to the construction industry. But actually, real quickly, I just want to talk about, every industry has its points of like, okay, what are the challenges specific to construction? There's a heavy emphasis on technology adoption, and not everybody is able to make that transition as easy. And so there's, psychosocial stressors that go along with that. Construction, mining, a lot of other industries have a high rate of injury, and that leads to a number of different psychosocial stressors, as well as real physical hazards, productivity and cost overruns, and then certainly what we're dealing with in construction and looking at labor shortages and retention is something to pay attention to. So I keep using the term psychosocial hazards. So here's some examples of what we're talking about, what I'm kind of present to you as far as psychosocial hazards go. Bullying in the workplace is certainly one of those. Some industries kind of have that stigma attached to it. When we think about one that comes to mind is like nursing, where eat your young is what it is, where you come in and there's this culture of lack of support for people coming into the industry, lack of control over workload. It's very, very well documented that if you don't have a good control of your workload, you don't have autonomy in your job, that's going to increase the amount of stress that you're potentially experiencing. And when you encompass that with maybe lack of support, social support, that also increases the stress. And then as a couple of slides ago, as you saw, the stress, cardiovascular, obesity, all those things, musculoskeletal, those are all related. Discriminatory practices, inflexible work schedule, incivility and harassment, all these things are psychosocial hazards that exist and can exist in our workplaces. And certainly when I say like you've got lack of social support and lack of control over your workload, that's going to lead to increased stress. The opposite is true as well. So you would find that in a workplace, if someone has some autonomy within their work, they have a strong support system, social network, a good supervisor leadership who's supportive of them, the stress level is going to be down. And that's ultimately why we want to try and impact those types of things. So it's an integrated approach. You can see here that within the work organization, the workplace, the physical, the chemical, the environmental, all the stuff we're very familiar with, in addition to the workplace psychosocial conditions. And then as you look at this Venn diagram, you see the home and community environment, the personal health behaviors, those all kind of fit into this workplace organization, health and well-being. So let's and let me check time real quick here. Okay, we're going to go through this relatively quickly. 5 defining elements of total worker health. So now we're getting into the nuts and bolts, and I'll get to the end of this presentation, and there's actually a great guide that NIOSH puts out that you could reference, go to the NIOSH website, go to the Total Worker Health Guide, and there are elements that you can start to pull out and utilize within your organization. It's actually a really good step-by-step guide, one that I've used within organizations before to implement total worker health. Number one, as far as the defining elements, is leadership's commitment. We're used to this from a safety front of things. When you're talking about safety culture and trying to develop that, you're not going to get very far if you don't have executive leadership and leadership involved, building relationships and developing that culture. So developing commitment for worker safety and health at all levels of the organization, that's that leadership piece. The design of work. So this is the second of the elements. Designing work to eliminate or reduce safety and health hazards and promote worker well-being. So this is okay, we've got to take a step back and kind of look at how our workers interact with the workplace. Worker engagement. we're not going to get anywhere with any kind of program if we don't have buy-in. If it's a, hey, by the way, here's another thing for you to do. You need to have engagement with the workforce to help develop these programs. What's important to them? Where are their pain points within the workplace as far as what's giving them stress? Is it the commute? Is it not having access to time off if they've got a work-life balance thing, where they maybe they might be an individual who's taking care of an elderly parent and trying to balance work, and that responsibility can add a huge level of stress. How can we create an environment that helps that worker balance those things? Getting worker engagement is going to be huge, and finding the right programs. Confidentiality and privacy, because we're getting into the health and wellness side of things, there has to be a level of trust that's there. If you don't have that trust, you're never going to get the worker engagement and the buy-in. And then the integration of systems. So integrating relevant systems to advance worker well-being. So avoiding getting into, this is where all those stakeholders come in. It's like, hey, total worker health, that's safety's thing. Like, let them worry about it. No, it's everyone's thing to be focused on and thinking about. So I talked about leadership commitment and supportive supervision. This is huge. Research has shown, and I had talked about it when I was talking about the psychosocial relationship and workplace. This is huge to having good, strong, supportive supervision. And sometimes we can get caught up within organizations, forget about our frontline leaders in construction. That's our four people that we have to be thinking about. Those are the touch point, and those are the people that we need to be staying close to and making sure that we have a support system in place for our workers. The redesign of work. I'm sure very many of you are familiar with the hierarchy of controls. We're used to it in occupational safety and health. The hierarchy of controls applied to the NIOSH total worker health is very, very similar. Elimination is get rid of the hazard, get rid of the stressor. That's going to help well-being overall. Substitution, substitute health enhancing policies, programs, and practices. What can we put in administratively to help, or I'm sorry, not administratively, but what can we substitute and move things around as far as exposure to things. Redesign of work, certainly education. I think a lot of times we stop on the education piece. Like if we think about a wellness program and we think, okay, I'm just going to educate folks on what a healthy diet is. There's further steps that we can put into place to help help those workers out. And then at the very bottom of the pyramid, encourage personal change. These things aren't, you can't force people to do these things, but going back to the buy-in piece, and I guess that's the next slide here, creating that culture of engagement. You have to get that from folks in order for them to be a part of that and accept that change. A big piece that I just want to highlight before I go to the next slide is employee surveys, getting that understanding. There's some great surveys out there. You can get them through the Total Worker Health Program. I use CPWR, the Center for Construction Research, and I just went through a survey a couple of years ago within my organization where we measured out overall health and wellness and safety climate on all of our job sites. And it gives you some real data that you can look back on. And one of the things that I took away from that survey within my organization is the piece that was missing was that leadership engagement. We had a gap there with a lot of our workers. And so then we could create an intervention to get leadership engaged and get them on a level where our folks felt like they had support from those individuals. So engagement really comes in from getting that buy-in from folks. The confidentiality and privacy piece, really, really important as we're talking about, the individual, their overall well-being. We can't be blasting that information, throughout the organization. It's very personal. And you can get into some serious issues when we start talking about blame the worker culture, blaming the worker. Oh, this isn't working because the workers just don't want to do it. Discriminatory practices, certainly need to be careful about that, and retaliations and penalizations as well. And so the final of the 5 pillars is just overall integration. How do all these things fit together. And that's the big piece of total worker health, is just getting, all the policies, all of the, occupational like health and safety risks on the job site fitting in with the work-life balance piece of it. All of it fits together, and that's the integration piece of it. And it really comes back to understanding your workers and your workplace. And I'll go back to that survey thing again. It's such a great starting point. Once you get that feedback from your workers as far as what impacts them, you can really zone in on what intervention you can focus on. Right. I think what I'm going to do here is hit right on the resources, because I know we're coming up to the top of the hour, and that one I didn't want to. I'd be remiss not to go back to this fundamentals of total health or total worker health approaches. This is going to add some language to what I was talking about. I hope you remember at the beginning of the presentation, this is I alluded to, hey, this is kind of abstract stuff. This is not going to be like, hey, I'm going to pull that out and I know exactly, what's going on here. So I would recommend, if you feel like a total worker health approach is something that you could apply within your organizations, this is a great starting point. Fundamentals of total worker health, it's a step-by-step guide to kind of go through, start out with your leadership, and then hit on those 5 pillars. Extremely important, really great. And it's a resource that I've used for practical application. Measuring worker well-being. I believe that, I think this is related to the overall guide that's there, but this is another resource to taking a survey of your workers and having a good understanding of what they're experiencing and where to focus on. The climate scale, as I alluded to, this is a different climate scale. I actually didn't use this one, but this is a great spot to go to and get an understanding. You can see, like, here's an example of like a question that would be going out to your workforces. My company reacts quickly to solve the problem when told about safety hazards, insists on thorough and regular safety audits and inspections, tries to continually improve safety levels in each department. So we get a measure of the different areas within our organization. This is very familiar when you try to measure maybe safety culture. And so that's kind of rolled into an overall approach. Other resources include the centers of excellence throughout the country. We're very fortunate to be close to one down in Oregon, and as Nancy's reference brought me to this meeting today, University of Washington actually has a course you can go through with more detail and more specific examples when it comes to total worker health. So a great resource as well through UW, Continuing Education Program. I think, everyone, that's what I'm going to end this program on today. I appreciate everybody's time. I appreciate the opportunity to come and talk about total worker health. I certainly didn't want to miss the opportunity to bring this up. I think this is the beginning of a conversation of how we're going to start integrating a lot more wellness and care for our workers, especially when you start looking at statistics at an aging workforce and how that relates to the workplace. We're going to have to get a little more sophisticated and advanced when we're thinking about that engagement between someone showing up to work every day and how they're showing up and how they can continue and hold a nice, long and healthy career. So thank you.
We certainly appreciate that quality presentation. Thank you, Justin, for your time today. And we are going to open this up for questions for Justin. And if you have any, obviously you can reach out to Justin directly, which he's provided his email for us. And so please ask any questions. Does anybody out there, you can throw your hand up, you can unmute your microphone and make any comments that you want, even if you just want to give them out a shout. I do see in the chat room while you're thinking about questions for Justin, I see a lot of thank yous there, Justin. Thank you. Nice presentation. Great presentation. Great. We love to hear feedback from everybody. Dale, yeah, that link for some reason that I posted was off Justin's presentation, and for some reason the HTML wasn't included in the link. So just try typing that in, hand typing that in. I don't know why I didn't include it in the link initially. So it is the correct link, but it just nicks the HTML at the end. Also, Justin, do we have access to a PDF copy of this so folks can access this information and kind of reflect back as of notes, essentially?
Absolutely. Yeah, I'll make sure that's available.
Excellent.
If you
we
send
will
it to me and Rhett, Justin, we'll make sure it gets distributed to those who are interested.
Most definitely.
Yeah, and we also have this, just so everybody knows, if you haven't tapped into this, is that we also have this on the YouTube channel as well. If anybody wants to go back in and listen to a certain of the entire program or a certain part of the program that really caught your attention, and this goes for Justin or any other speakers that we've had in the past, you can visit that on YouTube. And Brian, maybe you can give a little information on that as well, please.
Yeah, it's on the Smart YouTube website. I'll have this up in a couple of hours for anybody to access, and all the past presentations as well.
Yeah, it's a great resource to tap into if you think, man, I just can't remember what this person said or really, caught my interest. Tap back into that. We're trying to keep documentation as best as we can for everybody, so you can access this at any point in time. Any other questions from Justin? Just a lot of comments on great work, Justin, and I'll second that for sure.
Really
We
appreciate it.
appreciate it. Yeah, we appreciate you. So if there's no questions,